All right. So, before we look at my imaging and my reports, I want to tell you that I actually haven't compared. I would have, but I haven't had time. So I haven't compared whether it's gotten better or worse over the last decade. But what I can tell you is I didn't get imaging for the last decade because I really didn't feel that it was helpful to get imaging in the past. And I decided to focus more on my function, what I can do with this body, and to focus on doing the things that improve my body so that I can live the life that I enjoy. And no matter what my imaging says right now from a week and a half ago, I can say that I've lived my life to the extent that I want over the last 10 years. And that's what's important. So that's the message I want to start you out with. The only reason I got this imaging is because I'm going to be, and this is kind of an announcement to y'all right now, I'm going to be using myself as a little bit of a guinea pig and testing out stem cell therapy for to see if it's possible that it can regenerate spinal discs, intervertebral discs. There was a stem cell doctor clinic that reached out to me through core balance training and wanted to see if we could work together. And I didn't really know much about it. I did a bunch of research, and what I found is that the research is kind of inconclusive. There's not a lot of definitive anything about it. This is the forefront of a new type of medicine called regenerative medicine, and I don't see much downside to like side effects or like high risk complications with stem cells. So I'm going to be receiving the treatment, documenting my progress, maybe even video documentation for you all, and I'm going to be a guinea pig, see if it works. We can look at my imaging now, and then we'll take imaging in the future to see if maybe this can help discs grow and regenerate, because definitely I have disc degeneration and I've got issues with my spine. So that's the reason why I got this imaging. Otherwise, I would not have gotten it, and I would continue to live my life in a way that keeps me happy and functional. And I think that's much more important than diagnosis and imaging. So let's go ahead and get into this. Next step, let's look at some reports. 2009, I was 85, 95, 05, 24 years old, which was about around the low point of my back pain problems. So 24 years old, yep, that's when I committed my life to forgetting about all this stuff, doctors, and finding somebody else to solve my problem, and I decided that I was going to have to do it. So this was my doctor report. Severe lower back pain. I was 23. There it says. And my pain was worsening. And it also says, if you look down at the bottom here, lower back pain radiating down the left anterior thigh and into my buttocks. So I was having basically sciatica or radicular pain. And then I was having pain in my hips. At this point I was not really able to surf or do things that were fun. Okay, so that was kind of just the overall. You can read a little bit if you want, and then we'll go to the rest of the report. I think would be I numbered these, but the numbers aren't showing up. Oh yeah, okay. So this is it. So I got the MRI and from 2009, and it showed disc protrusion or bulge, stenosis, and it's in contact with my L5 nerve root. and it didn't show any compression. L5S1, there was a tear of my disc, and nothing really else. So normal curvature, normal bone marrow. So basically a bulging disc and a torn disc, or maybe you could call it a herniated disc. Now we'll go to the next one. This is from I believe this is also from 2009 as well. So basically it's rehashing the same thing. So we're going to go to 2013 now. 2013, I was at this is the low point, or this is, no, 27 years old. Maybe this is, I was also having another low point here. Low back pain and radiculopathy, which means sciatica. You can show you there. And so if we look down at the findings here, it says L4-5, there's moderate disc degeneration at L4-5. There's a 3 millimeter bulge or protrusion and stenosis, moderate stenosis. Moderate degeneration in the facet joints, and the left side of the canal is mildly narrowed. So that's L4-5. L5S1, make sure you guys can see this. Moderate disc degeneration as well. Disc space narrowing and desiccation. There's a 2 millimeter disc extrusion, which would be a herniation, and prolapse, also herniation. So, and no evidence of neural compression, although I was having radiculopathy. I was having nerve symptoms. So now let's get to the impression. So we have degeneration, bulge, and stenosis at L4-5. L3-4 just mild, and I think this was supposed to be L5S1. I guess they labeled it wrong. And I had the disc herniation. All right. Checking in with the chat. All right. So let's take a look at my images. This, which you may have already seen, is the most recent image of my spine, and this is an X-ray, so you can't see the soft tissues as well, but you can see the bone, and you can see here that there is, I would call this, I don't know, moderate to severe stenosis, or maybe they would call it moderate. In the report, which I'll show you, they called it moderate. And also a listhesis, or a spondy. So this was, I did a kind of an exciting thing with these images. This was kind of where I let my body just kind of relax into what one might call just like a poor posture, or not trying to connect to my core or connect to my anchors. And this is what my spine looked like when I did that. But then I asked the medical technician to take another image of my spine where I was connecting to my anchors, core balance training, my core, right? And she took another image, and this is the same, like 2 minutes later, same body, same spine, and I'm connecting to my anchors, as we call it. And you can see what happens to my spine. You can see that the space actually increased between my L5 and my S1. This is your sacrum here. I should have pointed that out before. This is the sacrum, and it goes down into the tailbone, coccyx right there. And this is the L5. And you can see there's more space, and they're more in better alignment compared with this image, where it appears that they're actually touching here, and they're not in alignment. So the edge of the L5 is over here, and the edge of the sacrum is here. So there's I don't know, some some overlap here, which you would call a listhesis. In this case, it's a spondylolisthesis or a retrolisthesis, depending on how you look at it. Okay, so we're going to go back to, so this is just like my belly is kind of, you know, hanging out a little bit. I'm just kind of like totally let go of my posture. And this was just a gentle connection to my anchors. I get better alignment. Here's the edge of L5, right in line with the edge of the sacrum. And I have more space between the vertebrae. So this is like, I don't know if, you know, people ask for evidence from us a lot. And, you know, this is just a small time company. We don't really have, like, we're not like FDA. We don't have like large studies done on core balance training, so we don't really have real evidence. But if this can be evidence to anyone that posture matters and that core connection matters, and it does have an impact on the alignment of your spine, and if you can believe that, then, you know, I don't think it's a big leap to say that this is out of alignment, and that would cause increased wear and tear on the discs, right? I mean, I think most people can believe that a door hinge that's in alignment is going to function longer and better than a door hinge that's out of alignment. It's going to wear down quicker. So to me, this is kind of logic. And for the people out there, believe it or not, guys, there's a lot of people out there that, I call them the naysayers. They don't believe that posture matters. If this is not enough evidence for you, then I don't know what is. And I did one more thing that was I thought was pretty interesting and exciting during this X-ray exam. I asked them to take one more image of me, and instead of connecting to my anchors and that type of core engagement that we teach in the program, I did a different type of core engagement that they teach in other disciplines, where you bring your belly button towards your spine, and I call it abdominal hollowing, but you know, pulling in your stomach, and they say pull the belly button in. So I did that, and this is the image of that. You can see that I'm pulling my belly button in, and you can see what happens to my spine. So what I noticed here, make sure you guys can see, what I noticed here is that my spine lost its curvature. It looks straight here, and then the sacrum is kind of a kink in the spine. It goes straight down, and then there's a hinge here, and there's not increased space between the vertebrae, between L5 and the sacrum, and it's not in alignment. You can see L5, the edge is clearly right here, and the edge of the sacrum is here. And so it's just, to me, it's visual evidence of what is happening with a healthy brace, where you maintain the curvature of your spine and you have space between the vertebrae, and what I would consider an unnatural type of core engagement. And they teach this in certain disciplines. I'm not even going to name the disciplines, but you have heard of pull your tummy in or pull your belly button to your spine. And this is what happened in my body. Maybe it's different for somebody else's body, but it doesn't look like a natural curvature of the spine, and it didn't fix the problem that I had with just like my belly protruding out type of posture. Okay, so hopefully that is interesting to you. I'm not able to look into the chat right now, but I'm just hoping that you guys find that as interesting as I do. Now what we're going to do, I'm going to leave it on this one because this is the one I want to inspire you guys to do. We're going to go to my MRI, and then we will read let's read the reports from we're going to make this larger. Okay, we're going to make this bigger so y'all can see it. Okay, hopefully that's visible for you. Okay. All right. All right. So, dynamic x-rays. Here's my report. It says the study shows normal vertebral segmentation with posterior pinging between L5 and S1. So pinging, I'm going to call that the stenosis that happened, where you could see that the L5 and S1 were looked like they were touching each other, and a grade 1 listhesis, which was where the L5 slid on the sacrum. Considering the rest of the normal bodies and spaces, the arcs of mobility and the dynamics are very limited without apparent vertebral slides. So they were looking at the movement in the vertebrae with the changes. They call it dynamic x-rays, with the changes in my posture, and they were just saying the movement is limited. So here's the MRI. I guess we can look at the report right now, and I'll make this larger for you. So this is what it says about my MRI, and it's harder to read in MRI, so it'll be good for you guys to know this before we take a look at the pictures. Okay, so the vertebral body is normal morphology, alignment and intensity. The evaluable elements of the neural arc appear normal. There's a disc bulge at L4-5, a disc bulge at L5-S1, a decrease in foraminal space, so that's a stenosis at L4-5 and L5-S1, and everything else is normal. So what I found to be interesting about this is, and now that we've already looked back at my previous reports from 10 years ago, is there hasn't been much change to my spine over the period of a decade. Okay? And also these reports, these results that I have from a week and a half ago would be considered normal for someone in my age group, age 37, approaching 40. Disc bulges would be considered normal. A little bit of stenosis would be maybe not normal, but not too uncommon. And so for my age range, I've kind of become more normal person, whereas in my early 20s, when I was 23 years old, I had more advanced degeneration and bulging and herniation, and it actually appears that my L5-S1 disc is no longer a herniation, it's actually a bulge. And so that you could argue that I may have even experienced some improvement over the last decade. And the message I want to send to you guys is, I didn't do anything in the medical system over the last decade. All I did was I improved my relationship with my body and my core. And so I felt that was the most important thing to me. And it turns out when I have re-entered the medical system this past couple of weeks, it turns out it's potentially improved or even just maintained my spine from a radiological perspective over a period of a decade. And you got to remember that I had a lot of damage happen. I was on a downward slope from age 20 or 16 to 24. I did a lot of damage, and then somehow it's kind of leveled off, and maybe you could even argue a little bit of improvement. So I'm very happy to see this. I wasn't expecting to have a normal spine, and so this is in line with my expectations. Let's take a look at the MRI now. And like I said, MRI is a little harder to see, so I will try and do my best to explain to you guys what I'm seeing. And I think this is it here. So this is, don't worry, it gets better than this. This is just the outside of my body. So MRI is a series of images, and we're going to go through together. I hope this doesn't do anything too bad. I got to make it smaller now. I'm making it larger for myself, so. Okay, so this is my body. I'm facing the same direction. And if I scroll through this, can see how my spine kind of appears and then disappears. And that's because an MRI is a bunch of slices of images that go through the body. And so we're gonna look at this. I think they would call this a sagittal view. So this is a sagittal view. We're gonna just look at the most interesting ones. You can see here my L5S1. You can see a definite bulge there. And that's bulging into the spinal, or maybe not the spinal canal, but looks like into a nerve, and there's a bulge there. So they were not lying. I have bulges in my discs. And I feel like you guys might want to see a larger view. So I'm going to zoom in for you, just assuming that. Maybe even a little larger than that, huh? So when I'm pointing at things, you can see exactly what I'm pointing at. So bulge, this would be the L5S1 disc. I'm going to keep going through. Now you can really see the bulges up against that white. So the white would be the fluid in the spinal canal. And so that's pushing into that, maybe not on the spinal cord, but into the canal. And you can see as I go through the slices, kind of go. Now I'm on the other side of the spine, and so another thing that you might want to know is that the white inside the disc is fluid. So these are nice healthy discs. This would be L3-4, L2-3. They have fluid inside, where L4-5 not much fluid, and L5-1 even less, almost no fluid. So this would be disc degeneration, and so if you've ever been diagnosed with degenerative disc disease, that's what you could diagnose me with. That I have degenerative discs because I just don't have that nice plump fluid in all those discs. So this is another different type of contrast, but it's the same view. You can just see the discs. You don't see the fluid as much. But for a radiologist, it allows them to see things that I don't even really know. It's just another view. This is the transverse view, and it's from top down, so you can see the discs. There's some fluid in that one, and I think we're going down to this. This would be L5S1 disc, and then sacrum here. So you can see that. I don't have a whole lot of comments on that. And this is a frontal view. So we're going from front to back. You can see fluid in the discs. And I think I can adjust. I guess not. There are times when you can adjust the brightness. But, all right, so that's that. Nothing too exciting there. This is really the one that is the most interesting. You can see the disc bulges, where in the past, apparently I had a herniation, and it would have probably pushed further into the canal. So that's my imaging. I'm going to jump over, and we'll start the next portion of the stream, and I'm going to look into the chat here, and just wondering what's going on in here. So thank you guys for your patience. Sorry about the beginning of the stream where I had no volume. I was having some technical difficulties before the stream started, and so that just kind of went right over my head about the microphone. All right, so we'll look at the bottom of the chat here, just because I know the top is just full of questions that I will be answering in a minute, and the bottom is more relevant to the images. So people seem fascinated about some of the things. Cool. Can you review how to engage core anchors in standing? Yeah, that is the lesson in the program. It's an anchor triad lesson. And I will, if I have time today, I will review that. And Tony Robbins jumps about 1,000 times a day. I'm gonna share the I'm going to share the chat with you so you guys know what I'm looking at. Let's see if I can find this chat. Is this it? There it is. Hey guys, there you are. And make this fit nicely here. All right. So I'm here, and we're talking about Tony Robbins. He's had stem cell therapy, and he said it's the first time he felt relief in 14 years. Wow, that's exciting. So we'll see if I feel relief. I'm gonna make sure and document for you guys, my progress. We'll go, day of the treatment. We'll go maybe day after or 2 days after, and then we'll just do weekly progress reports. And like I said, I'll be the guinea pig, and if it works for me, the reason they reached out to me, I really appreciated this about the clinic called Bio Renati that reached out to me, is they wanted their patients to, after they get stem cell treatment, to do the best thing for their spine, because obviously they believe that it's important what you do after the stem cell injections that could help support the healing. And they thought that core balance training would be a good thing for them to do, and that's why they reached out. And so I'm gonna be doing that, and give myself the best chance of regenerating some discs. We'll see if we can. Jennifer, great evidence. My imaging is super ugly, but my back feels great after 3 months of CBT. Awesome, Jennifer. Thank you for sharing. All right, guys. Thank you for everything, all the kind words. We're going to go to the top of the chat, and I know there's a lot of people been here live waiting for me to answer them, so I'm going to do this first, and then I will go ahead and announce the Student Hub Student of the Week at the end. So Patrick Sear, hello, if you're still here, and you say, have I found any benefits from THC, CBD topicals? They're expensive. Are they worth it? Thanks for your guidance. I have not used them at all, so I don't have a comment on that. And if it was effective, it would be more so effective for pain relief, I believe. And I know that those substances do have an impact on pain sensation. Differently. THC and CBD are different, and so if you say take a bunch of THC, it could actually increase your pain because it could increase your focus on the pain. And remember, that's where pain actually originates, is in the brain, and if you focus on it, it increases. And with CBD, I think it's a little bit more a relaxing substance, and so it can actually potentially help reduce pain. So but there might be, I'm sure there are optimal ratios of both to get the best benefit, and I don't think it would go beyond into like helping your posture or anything structurally. Yeah, if they're worth trying, I think companies will give samples. I've never tried it, but they're worth trying, and that's how I would gauge if they are worth it. And thank you for the kind words, Patrick Sear. Next, Ellen, why do some people with disc damage or other spine issues that show up on MRIs or x-rays not have back pain? This is a fantastic question, Ellen. I don't know the answer to it, but it's true that there's a very poor correlation between damage seen in an x-ray or an MRI and pain. Extremely poor. Where it's not only what you say that they can not have pain and have damage, but the reverse can happen, where someone can have severe pain and really minimal to no damage in their x-rays and MRIs. And so the best answer I can give is what I kind of mentioned a minute ago, is that pain actually originates in the brain, and there's a large influence of your mindset, your focus, different mentalities. Are you experiencing anxiety? Are you experiencing other things that can increase pain, tension, stress and tension in the body? Or are you, do you have the Mamba mentality, like one of my inspirations, Kobe Bryant, who said, it's just pain, I'm just going to keep playing. And he was infamous for playing through incredible amounts of, injuries that people would normally perceive to have incredible amounts of pain. And it was, I believe, a mentality thing that he had. So that's the best way I can answer that. Jennifer, I have anterior hip pain and popping triggered by sitting and bending. How can I begin conditioning the hip flexors and hamstrings in a way that won't pull on the lumbar spine or irritate the SI joints? So my first thought is you're not going to be able to prevent them from pulling on the lumbar spine. They attach to the lumbar spine. So anytime the hip flexors contract, they must pull on the lumbar spine. But what you want to do is you want to stabilize the lumbar spine with all the other muscles so that it is a stable foundation, and when they do pull on it, they're not yanking on it. They're not moving the lumbar spine into a collapse, what I would call a collapsed lumbar spine. And so you're engaging and preventing that from happening. So that's the goal. And if you can protect your lumbar spine or connect to your anchors, then that's how you can train your hip flexors in the ways that are appropriate. So I wouldn't just go to the extreme and do some extreme range of motion sit-ups, hanging upside down from a pull-up bar. I would progressively increase that over time as your abdominals get stronger and have more ability to stabilize your spine against stronger forces. So that's a progressive thing, and that's really as simple as it is. The anterior hip pain, depending on your age, Jennifer, if anterior hip pain in the older generation, older folk, is most often arthrosis, more accurately. If you're still pretty young and the popping is consistent with something that I would consider like a tendinitis or popping tendon or clicking tendon, it's popping over a bony landmark in your hip. And so, yeah, it is a hip flexor thing. You want to strengthen your glutes. I don't have any problem with the hamstrings. I think they're a protagonist in this battle against the hip flexors. So I have no reservations about training the hamstrings. They won't hurt anything by training them. So hopefully that helps. SI joints, you want to do symmetrical bilateral stuff. Making wonderful progress in the program, but having to be careful with unilateral. Yep, so you know that already. L2-3 spondy and SI joint instability. I'm also fused at L5-S1. Jennifer, if you're still here, yeah, you got a few things going on. And so these are all, obviously, I'm the type of person that believes they're interrelated and potentially caused by a similar overlying problem, posture, muscular balance, but they're all kind of different things as well, right? Especially the fusion. Fusion at L5-S1 means you're higher likelihood to have instability problems above and below the fusion. So this is kind of a pattern that happens with fusion, is the joints above and below start having to move too much because there's no movement in the fused joint, and so it becomes incredibly important to have a healthy uniform amount of movement above and below. So you want to make sure your hips are moving. What's the range of motion like in your hips? That will help take the load off your SI joint, the hip joints. And then for the L2-3, you want to have that uniform amount of movement, and L3-4 is going to be a huge one. L4-5 is going to be a huge one. That's between the fusion and the instability. So that would probably take somebody with a trained expert to have hands-on, gentle, not thrust manipulation, but gentle mobilizations of those joints to make sure they're moving, and then above the L2-3. So L1-2, T12, L1, and above that even, make sure those joints are moving so that the L2-3 doesn't have to be like a door hinge, taking all the movement. So yeah, it's going to be a combination of stability and mobility for you, Jennifer. Fuzzer, all right, SoCal, probably a hot day because I'm on the edge of SoCal in Santa Barbara, where some people consider it central, but it's SoCal, and it's pretty hot here. Kara, hello. Fuzzer, is tingling ever part of good pain? So far, when I feel tingling during an exercise, I stop, reset, and do again. That's a really good question. So I believe that tingling can be a good sign if the tingling has moved closer to the source of the nerve impingement. So if the tingling was in your toes and your foot, and obviously that's not a good sign, but you do some things that are right for your body, and the next day you're doing those things and you're going through your day and the tingling is no longer in your toes and your feet, but it's in your calf or your shin, then I would consider that a good sign. Now, the tingling isn't inherently good, but it's just good that the location of the tingling is closer to the source of the nerve impingement. And that's the only time I think tingling would be good pain. There are other types of tingling, like, hand falling asleep, leg falling asleep. Is just not necessarily good or bad. It's just a part of life that sometimes the nerve gets temporarily compressed. So that's not what I'm talking about. I'm talking about more of a long-term compression. Ms. Tran, in your last video, you mentioned it took you 1 to 2 months to clear your SI joint issues. I wonder what exercises of CBT program you did with these months. Did you experience centralization during your healing, which I just talked about, right? So yes, I did. I've experienced centralization or centralizing multiple times in my life. And so that is a real thing. It's happened for me. And the exercises that I did, the biggest factor I think was, what did I avoid? The movements that irritate an SI joint, I avoided those, which I made the video about. And the exercises I focused on were obviously the bridge. Single leg bridge was something I had to progress towards. I have made an entire video about the things that I've done for my SI joint. So I'm wondering if you've seen that. And squats done healthily can help stabilize an SI joint. Deadlifts done in a healthy way can help stabilize an SI joint. There's no secrets here. There's no magic like exercises. It's just about how you do them, and these are all really basic functional movements. Bridge, deadlift, squat, and then avoiding certain things that irritate it for a while. And then you progressively reintroduce those things. Kushi Goyal, we got belly flared up post butt buster. My hip rotators got angry. A lot of burning. You left GT and SI joint. GT. I don't know. I had my pelvic floor assessed, very tight. Only during the basic front and back anchor exercises help. I don't know. Immediately know what GT is. So you can help me out with that if you want. So I recently put out a video about this, what to do when exercise causes pain, and one of my strongest messages was, you got to ask yourself questions. Why did this cause pain? The butt buster involves movement. It involves pushing your knees out into a stretchy band. How far were you pushing your knees out? Were you pushing out too far? Were you doing this too intensely? Or was it the exercise itself? Is it too similar to the causes of your back pain? So I highly recommend watching that. And if you were, for example, pushing out too hard, my recommendation is don't completely stop doing the exercise and don't push through the pain. Do something in between, something in the middle. You got to work in that gray area. Maybe try pushing out just a tiny bit and see if that irritates your SI joint and your GT. If it does, then we know, okay, most likely it's the exercise, not how you did the exercise. If not, then we know it was related to the amount of amplitude and intensity that you were doing the exercise at, and we need to work right up to your edge and stop there, stop just short of the pain, and then try to push that edge over time. This is an art, much more than it is a science, and you have to be just constantly listening to your body and having a fluid conversation. It's fluid because it's constantly changing, and you have to be listening actively and responding to the best of your ability constantly. It's not a job that you do lightly. You tune in and you focus. Why your hip rotators get flared up so much, and you have same flare-ups again. So the reason why could be numerous reasons. Your history, your body type, what's going on right now, and so those are, you got to ask yourself questions, and you got to take that approach that I recommended. It's the best thing I can offer you. Your QL gets tight too. Okay, yeah. So if it's all on the same side, you got a left-right thing going on, and then I have that strategy for left-right imbalances. We talk about it in the program where every exercise you gotta compare left and right, and you gotta focus more on the side that is harder to maintain good form and good stamina, and catch that side up to your strong side. Kathy, Jennifer Nay, how did your operation go, and do you have any regrets? Stoogie, it may be more effective not to focus on imaging results. Correct. I have seen people with perfectly normal imaging who were in a lot of pain, as well as people with really, yes, thank you for sharing, Stoogie, I completely agree. Brienne, I highly recommend CBT. All right, thank you for sharing, Brienne. Yeah, because I couldn't recommend it, I've never tried it. Sherry, I have scoliosis at this juncture between lumbar and thoracic spine. Okay, when I lie on my back, I feel as though something is pushing from the inside at the point I mentioned above. That could be a sign, Sherry, that there might be some instability happening at the T12S1, the thoracolumbar junction. When you lay on that, it's causing pain. It shouldn't normally happen, and so this is going to depend on a lot on some other things, your history. Did you have any kind of trauma to that area? It could be something as simple as a spinal adjustment. That area of the body is vulnerable to instability because the rib cage stops at T12. So T12L1 is the first vertebrae that doesn't have that cage, that rib cage, which is extra support. It's the first most unsupported joint from going down from the top of your spine. So it's not super uncommon. It's less common than an L5S1 instability, but it's not surprising. And so that's what I would look into. And you want to make sure you're mobile in your thoracic spine, your rib cage, and down below it, so that the T12L1 joint isn't taking so much stress. You want to have the mobility above and below. And the scoliosis, I was just talking about left-right imbalances. So you constantly, every exercise is a diagnostic tool to you to see which side am I stronger at, which side am I weaker at, and then you want to focus more on developing good form and stamina with that weaker side. When I started the program, this point was really sore, but it's a lot better now. Is this a result of scoliosis? Maybe chicken or the egg, but it's definitely a factor, and there may be other factors. So the scoliosis is actually a result in itself. The scoliosis is a result of something else. And this is the way I want you to look at it. It's posture, right? Scoliosis is a diagnostic medical term, but really what's happening is your posture is curved in a sideways plane of motion. That's what's happening. So what's causing that? And that cause that's upstream of the scoliosis is probably also related to the T12L1 situation. And what is the reason for the outward pressure? It may just be a sign of communication from your body that your body doesn't like getting pushed on that area. It wants it to be stable and not pushed on. And so there could be a little swelling there, or you can get some imaging and see if there's maybe like a cyst there. It's there's a lot of possibilities, but there's more things that are more likely, which is what I was talking about before. Brand, do you have a brand that you can recommend? And I've tried half squats, and now my left knee is swollen and stiff. I'm not able to bend it or side load it without severe pain. What exercises can I do to strengthen my knees? I'm 61, thank you. And give a knee. So half squats, that is already, you've already modified an exercise to limit the amount of motion, so I'm not going to recommend that. How are the exercises you do? How are the other exercises you do? A lot of the benefits of a squat can be captured by doing a deadlift. And a deadlift, so you can get a lot of the same benefits, but a deadlift does not stress the knees nearly as much. And so I would consider trying some light deadlifts and see how you do with that. That would be my recommendation. And it does strengthen your knee. It strengthens the stability of your knee doing a deadlift, because it's still carrying the same amount of weight or load, but it's having to stay stable while your hip joint moves. And there's a lot of muscle contraction. It's called co-contraction that has to happen around the knee to stabilize the knee, and that's good. You want knee stability. But if you're getting swollen and stiff knees from bending your knee, then it's highly likely that there's something going on in there. Could be patellofemoral tracking disorder, where their kneecap is a little out of alignment. Could be a meniscus thing. Could be MCL thing. The side load makes me think it's either meniscus or MCL, and so you want to consider that, and that would mean that your knee is unstable in the frontal plane, side to side, and that would require you to stabilize it in that plane, which would be not so much deadlifts, because deadlifts you're on two legs and the other leg is stabilizing side to side. So you want to consider doing single leg stuff. Maybe in the beginning it's just standing on one leg. Can you stand on that leg and keep your balance? Trust me, there's a ton of co-contraction happening in your knee muscles, and you're developing stability in your knee simply just by standing on one leg. So that's where I would start, and keep something nearby so you can keep your balance if you need to. Maybe one finger on the countertop, or no hands, but keep it nearby, right? And then you progress from there. A little mini, there's a lot you can do, but you gotta start there, and then listen to your body, and then the next day see how your body feels. Okay, then we get to the no audio part, where a lot of people are trying to help me out, and I wasn't looking at the chat, so sorry about that. Deborah White, how do you decide on the best position for your feet for the perfect bridge? I often have to adjust them in closer, or my shoulders start to slide back when I elevate my pelvis. Yeah, I think closer is better in general, unless you have super tight hip flexors. Then closer is just going to put more tension into your lumbar spine. It's going to be harder to stay connected to your anchors. So it's about, you got to find moderation for you. It's not pulled all the way in, but on the closer side, I think is better for that very reason that you're talking about. I'd say ideal is where your shin is vertical, so that your lower leg is vertical perpendicular with the ground. Brienne, wholesome CBD. All right. Jennifer, okay, we're talking more about, okay. Rough recovery, 2006. This is the fusion. You believe it was unnecessary, misdiagnosed. Wish you had this program. Yeah, I wish you did too. It didn't exist, so you can at least know that it did not. It was. I was still in my early years of learning about long-term back pain, and so I had to learn the hard way too. All right, no sound, no audio, can't hear me, oh no, I'm just screwing up big time. I know. All right, we're gonna go down to, is the tone in a muscle possible to feel when touched? Yes, absolutely. Yeah, you can feel the tone. How much is that muscle pushing back at you, right? Does it feel like you're pushing on a guitar string, or does it feel like you're pushing on a piece of dough? So the tone is palpable. Yes. I can see your mouse. That's a funny thing. 2 months in, noticing improvement. Biggest issue is waking up every morning with excruciating back pain. So that's maybe something to do with the mattress. I don't know. During the day is fine, but now sleeping on my back, I wake up every day in pain. I would consider sleeping on your side, Eric. Potentially the mattress is too soft. Sorrel, I'm extremely claustrophobic. Can I get an MRI and live through it? Yeah, you can, because they have something called an open MRI. If you're still here, Sorrel. Open MRI is for claustrophobic people. Stein, how can I train high intensity condition when using quads? Always hurt my back. Any glute cardio you know of? Swimming? Glute cardio. One of my favorites is stand-up paddling, or you don't have to have a board, but you could do it with like a cable machine. Basically a stand-up rowing machine is an excellent way, because you're doing little mini deadlifts every time. Your core needs to be engaged, so I really love that, and it's cardio as well. So that's my recommendation. Gilda Garcia, cool. Stein, how can I train high? Oh, you already just said that. Swimming, I mean, yeah, swimming is so complex, it depends how you do it, but give it a try, and you can always try and improve your form if it doesn't feel good. All right. Yeah, so stem cells, I'm going to Bio Renati in Puerto Vallarta. Tarloff cyst, do you know anything about it? I've heard of it. That's the maximum that I know about it. I will look it up, Galina. Tarloff cysts. Kathy Weens, good docs. Now reserve surgery for definitive nerve impingement issues. It should be very last resort. Might cause instability above and below the fusion, but this program is helping greatly. All right. Oh, good doctors. Yeah, definitely. Yeah, completely agree. Should I apply the anchor triad in all gym exercises such as bench press and other gym stuff? Absolutely, Stan. Yes. Especially if just one, if it's too complicated, just the back anchor or just the front anchors, whatever is most appropriate. So bench press, the back anchor would be most appropriate because it's connected to the bench. So that would be a really good one for that. All right, lots of good feedback here, and I'm not sure what he's referring to, but yeah, everything is going to affect the facet joints as well. Margarita. All right, great. Yeah, hope is huge. I hope that you can just have that confidence that this program does help people, and it helped me, and that it's going to help you too, because that confidence is actually a huge factor in itself. Cushy, can you please review how to engage core anchors and standing? That's going to have to happen just because today's stream's going so long. It's going to have to happen on another stream or just a review video of the anchor triad. But I recommend you go to the anchor triad lesson in the program. And we are, Margarita, you won't regret it. Oh yeah, cool. Thank you, Sherry. Tony, I read that one. All right. My gym is super. I think I already read this one too. All right. Yeah. Thank you, Jennifer. Paul, you're welcome. And then just lots. Are you going to center in Tijuana? No. I'm going to Puerto Vallarta. I looked into all the centers in Tijuana, Gilda, and yep, I looked into them. All right. Currently, are you living pain-free without any medication? KMW. No, I'm not living pain-free. I am not immune to back pain. I do get back pain sometimes. I've had back pain actually recently, and that's related to the lifestyle that I've been living. I've been driving across the country and driving way too much, and it affects my back. So I don't believe anyone is immune to back pain, especially if you have a history of it. It's about living a healthy lifestyle, making healthy choices, and if you have to do things that doesn't feel good for your body, it's about doing the right thing to counterbalance that and do healthy things before and after that. And so that's what I'm doing. But yeah, I've had back pain recently. Maybe I'll talk more about that in a future stream. No medication. Definitely, the only medication I take is it's not medication. It's I take fish oil, I take turmeric, and occasionally vitamin C. Those are the things I would take, but no pain medication. Don't forget student of the week. Thank you. I will not. So I'm going to go ahead and do that since we had the last question post, and then if I have any more steam left in me, I will answer the last questions that are listed. So let's switch over to student of the week, and we're going to do today requires patience from the viewers because I didn't have all my stuff together. Maureen M is Student Hub Student of the Week. Congratulations, Maureen. We're honoring you for celebrating with others during their moments of triumph, offering kind words during the moments of hardship. That is so awesome, Maureen. Thank you for being supportive in all ways to the people of the community, this shared community that we're all in. Your dedication to gaining a profound comprehension of the program's core concepts is inspirational. It inspires me. I've got goosebumps right now. Thank you, Maureen. We're going to reward you. We're going to honor you with adding a month to your membership. You have to do nothing. We will add the month to the back end. Thank you so much, Maureen, and congratulations. I hope that inspires other students to do the same because it actually, whatever you want to receive in life, just give it out. Just give it out. Give out buckets of it and you will receive that back. And so Maureen's helping others, and I believe that's going to help herself as well. I have no doubt. So, and that gratitude is huge as well. So showing the gratitude for the gains that you've made is another way to just reward yourself. All right, so I'm gonna just briefly look through the rest of the questions. It looks like there's a bunch more questions, and I don't have the steam to get through all of it. So I'm gonna just answer what I can. What am I doing here? Properties. Well, all right, I can't get back to the chat properly, so we're just gonna read a couple here. Joanna, does the program target neck? It targets overall body posture. It does seem to have a positive influence for people who have neck pain. So that's the feedback I've gotten, although it is directly targeting the lower back and the core. But yeah, I've had many students give feedback that it does help with the neck as well. It's just not focused on the neck. Car accident, SI joint. Yeah, it can, it can take months. They may not spontaneously return back to a healthy muscle, we call it a length tension relationship. Sometimes you have to do things to encourage that, and so that's kind of what the program does. Yeah, so they're tight, they're protecting, and so yeah, in order to get them to let go, the body has to feel safe, and it must feel stable to feel safe. And so that's kind of what we work on in the program, is core and spine stabilization. Patrick, L5S1. Is there any benefit to not working my spine so much? Yeah, there's something to be said about that. I mean, we want to have a healthy amount of movement and stability in the spine, but taking the spine to all the ends of range of motion, touching your toes and backward bending, that's not going to be good for somebody with a spinal condition. You kind of want to work within the controlled ranges of motion, meaning don't go all the way to the end of the range. And so that's the amount of movement, and you want to have control through those areas when you're trying to heal. Only when you have healed do you want to try and increase the ranges of motion. So hopefully that, and moderation and everything. So the amount to work your spine definitely is, there's too much and there's not enough. So you've got to find that balance. Yeah, GT is greater trochanter. Thank you, Claudia. I should have thought of that. So GT pain, yeah. So left-sided, that's usually IT band. Okay, now we have workout hub. SI joint pain, yeah, I mean, yeah, everyone here has got low back pain or SI joint pain, so I do recommend the, at least the free trial of the program. It's free. Activate my abs, but lengthening my body, but it makes it worse. So you're going to want to try and change the way that you're doing that, Mike, because your body's communicating to you that it doesn't like that way. It doesn't mean stop. It doesn't mean push through. You got to work in that gray area somewhere in the middle. I guess there was only one more question, so I'm going to go ahead and do it. Thank you guys for your patience. What to do if you were told you have surgery? You got to make your own decision. You got to look at all the options. You got to educate yourself, and you got to be able to look in the mirror and tell yourself, I've done everything that I possibly can do on my own to heal my body. If that means core balance training or some other thing that you can do to take care of your spine and your body before going under the knife. That's what you got to do. You got to look yourself in the mirror. And quick question from Ms. Tran: can we train glutes every day? Does it increase muscle growth? Like glute max, I wouldn't say every day, unless it's low level, like the bridge. Yeah, you can train it at a low level every day, but I wouldn't train it for strengthening or muscle growth every day. That would be like high intensity deadlifts. You want to give like a day of healing in between, because it's a power muscle. You train your core and your abdominals every day. All right, so that's all the questions in the chat, and I'm going to close this up just with a message that I started the stream with. Looks like I'm still got people here, so still people listening to what I have to say. I'm going to try and give you some helpful words right now. So we looked at my imaging, we looked at my reports of my spine, and it wasn't pretty. There were serious problems with my spine, and that could potentially have a major psychological impact on me. Go, man, I have a spondy, I've got stenosis, I've got bulging disc, I got degenerative disc disease, my spine is kind of broken. Maybe I shouldn't be doing all these fun things and these extreme activities in my life. Maybe I should take it easy. And that psychological impact can lead to a spiral of what we call I'm just going to say just not participating in life. It's a lack of participation in the things that you do, and so I just really want to emphasize that imaging is not the end-all be-all. What matters is how you feel, and what's more important than getting imaging is listening to your body and doing the things that make your body feel better, so that you can go do the things that you enjoy in life that keep you happy without fear of hurting your back. And that's huge, because doing the things that you enjoy but fearing hurting yourself while doing them is not a way to enjoy life. You want to be able to feel confident in the things that you're doing, and you want to be able to do them, and that's what's the most important thing. And the path to doing that involves listening to your body. I've talked a lot about that in the past. It is a very big responsibility, and it's much more than just hearing pain or not hearing pain. It's an active process, and responding to your body appropriately and continuing to have that conversation, that fluid dance of listening to your body never stops. And keep doing the things that help, that seem to make you feel better, and build on that, and get to the point where you can do the things that keep you happy, because that's what it's all about, and it's not about the imaging. So with that said, I'm signing off. Thank you all for being here, and until next time, get down on the floor and connect to your core. Take care, everyone.